Kaeser. She's currently serving as Director of the Office of Legislation and Public Policy at the Eunice Kennedy Shriver National Institute of Child Health and Human Development at the National Institutes of Health.
Nice
That's a long
job. That's
tongue
very
twister. I had to read it, though. She works as a liaison between the NICHD's leadership and its many constituencies, which include Congress, the scientific and research advocacy communities, the public, including the organizations that comprise the Down Syndrome Consortium, of which she is the executive secretary. She is also one of two primary authors of Down Syndrome Directions, the NIH Research Plan on Down Syndrome, published in 2014. And prior to joining the NICHD 16 years ago, Ms. Kaeser worked for over a decade in women's health research and policy institute issues at the Alan Guttmacher Institute. And before that, for 3 years on Capitol Hill as a legislative assistant for Representative Jim Moody, Democrat from Wisconsin. And in her other life, she has been a health counselor at the Washington Free Clinic, a health education teacher for 8th grade students, and as a certified parent educator. She has a law degree from Vermont Law School and did her undergraduate work at Dartmouth College.
Thank you. Thank you. I am so happy to be here. My mom is very grateful because I spent last night with her. She now lives in Southern Pines, so thank you for facilitating that as well. And this is just a great format. I am in the lucky position because I've now heard from 3 different wonderful researchers and research organizations. So hopefully this will build on what you've heard already this morning. And I will be definitely available. I'm already getting a couple of questions, so I will be available afterwards for further questions. For those of you who aren't super familiar with the National Institutes of Health, my institute with that long name is one of 27 institutes. So we're at the Child Health and Human Development Institute, and it's a little bit different from some of the others. It's not focused on a disease like the National Cancer Institute or an organ system like heart, lung, and blood. We are really about human development. So we look at what goes right, what goes wrong with human development, and as well as women's health is the other major. So we do a lot of pregnancy and childbirth and delivery related research. To be honest, the last 3 weeks have been completely subsumed with Zika. So it's been very interesting. All right, as someone mentioned earlier, I am here to talk primarily about DSConnect. My institute has the lead. We are definitely not the only institute that does Down syndrome-related research at NIH, and we'll see a slide later that shows you all of the institutes that do. But we have the lead because of the whole development issue. And we held a meeting in 2010 with most of the national organizations, researchers, and families to really talk about what should we be doing. If we have, I know NIH has, it sounds like we have a ton of money, and we kind of do, and it's all your taxpayer dollars, but when you spread it across all the conditions that could possibly happen to a human being, we have to parse them out a little bit. So we did ask the community what would be the number one thing, and the number one thing that emerged from that meeting was a research registry. Some of the groups had actually talked about establishing it. They felt they were closer, and it's true, they're closer to the families and could be more responsive to the families. But in the end, I hate to say it, money is always a factor, and none of the individual organizations could really pony up the both establishing a research registry as well as maintaining it over time. So I have to give my former deputy director, Dr. Yvonne Maddox, a ton of credit. She's the one who finally went to our director and said, we have to do this. So we issued a contract in 2011, and the DSConnect was actually launched in the fall of 2013. So it's not very old. And we are, you'll see later, we're at about, overall, including the international participants, we're at about 3,200 participants now. But this is what it is. It's essentially a survey tool. Registry is a survey tool where you, after appropriate consents, and we can talk more about that later, submit information, either an individual with Down syndrome may do this him or herself, or a family member with their permission may go ahead and submit this information. It collects, we are hoping eventually to really spread this around the world. We've just launched the Spanish version of DSConnect, and we're hoping to expand to other languages as well. This is probably my key take-home point. The information you submit is very carefully protected, and I'll talk in a minute about the security measures. It is de-identified, so when you see that term, this is what this means, is that we take out all personal identifiers, like your name, your address, your street address, date of birth. We use that information, only a very limited number of us see that information. We use it to create what we call a GUID, a Global Unique Identifier, and that's just a number. And that number is not then associated with your record that you've submitted. That is what goes into coming up with the de-identified, the graphs and charts and other data that you and researchers who access this site are able to see. We've tried very, very hard, and that's what I'm going to talk about actually quite a bit. We've tried very hard to make this a two-way street with the families. We view the families as our partners in this. So we did a ton of beta testing. We did a ton of, we actually make tweaks to it all the time based on feedback that we get from families. And what this allows us to do, it's been very exciting. We have 3 levels of access for researchers. One is that researchers get to look at just the same de-identified data that all of you look at, again, not with any personal identifiers. The second level allows them to do a little deeper dive, like how many people in the Southeast, if they think I'm just making this up, but if they think there's an environmental factor that is affecting some condition, they could say, how many people in the Southeast have this condition? So we work with them to do a little deeper dive into the data. The third level, which I will get to, is actual participation in clinical trials. We never give out personal information to the researchers. What we do is, if you have consented up front to be contacted about a clinical trial, the researcher contacts us. There's only 3 or 4 of us that see these data. And they say, we want to recruit for a congenital heart defect survey or study. We then we do a scan of the database, who has congenital heart issues in our database. We send the researcher's information to the family. The family can choose to contact the researcher or not. So I did want to explain that, because that's a very, very critical way that we keep your information private. Obviously, we wanted to work with the families because you know them the very best. This just gives you a sense of kind of what I've been describing. These are family-centered. This is a family-centered registry. We are working with a contractor called Patient Crossroads. It's an Oregon-based firm, and they use this model. They've used it for a number of conditions. Probably the other one that we work with them the most on is Duchenne muscular dystrophy. And you've already seen this slide. Dr. Spence showed it earlier. I'm on the team that helped develop this website. This is on the main NIH, so you just go to nih.gov and then look for clinical research in you. And there's a ton of good information for families or anyone considering participating in a clinical trial. I called these 2 out because DSConnect is listed on the list of registries. And then so a lot of the questions that Dr. Spence ran through earlier, which I think are critical for families to think about as they are considering participation, it's all under this link. So this will be on the YouTube. So I wanted to also make something else clear about DSConnect. Because of those first two tiers of information that I mentioned earlier, where researchers can look at de-identified data as a whole of everyone who has chosen to participate, that helps them just design their studies. They can look and see, there are more people reporting leukemia than I thought there would be. Maybe I need to do, a real look at a leukemia trial. It allows them to help design their trials. So even if ultimately you choose or you don't give consent to participate in a clinical trial, having your child's information in DSConnect is really, really helpful to the research community. WIFM is what's in it for me. So these are some of the things, as I mentioned, we got a lot of feedback. One of the things I was saying earlier that I did a podcast with the DADS group about a year and a half ago. And one of the things, they were very funny, they said, oh my gosh, it's so great to have all this information. I mean, it takes your time to put it in, but once you have it in there, all you need to do is periodic updates. That way, anytime you go to a medical provider, you can download all the information that you need to take. So say you're going to a new healthcare provider, it's all right there. We also keep updating, as CDC just published some new growth measurements, growth charts, so we're uploading those. So it's a way for you to keep, we try to give this back. We try to keep this very updated, so it's a really good resource for all of you. We also have compiled a really nice list of healthcare providers. It's not perfect, it's not absolutely everyone who works with Down syndrome in the country, but basically we get these from families. So they get to put in their own healthcare provider if they think it's someone who really understands Down syndrome or some aspect of Down syndrome. So this is, say you move. It's so nice to go to a new community and be able to know right away who you might be able to reach out to. And as I mentioned, you can print out your child's entire health history depending on which questionnaires you've chosen to fill out. So let me talk for a second about why, we've heard this morning and you're here, so you obviously have some interest in research, which we really appreciate. One of the key things that I think a lot of people lose sight of is, and this is the reason we don't know all the answers by a long shot, the good news is the life expectancy of people with Down syndrome has increased dramatically in the last 40, 50 years. It's almost mind-boggling. You hate to think of what was going on earlier to have the lifespan be so short, but it's 450% increase since 1959. That is an amazing amount of progress. But what that means is people are living so much longer, people with Down syndrome. We don't know much about their aging, and we don't know what happens. Say they have a congenital heart defect. How does that play out over the decades? So that's one of the reasons we need to do this. We've talked actually a lot this morning about cognition. That probably is the number one thing we hear about from families is families are interested in improvements in cognition. They really, again, some of these intervention programs can be designed so that they really maximize that individual's abilities. Sleep. Anyone here have issues with sleep? That is another major topic that we hear about. Dr. Jamie Edgen, the reason I called it out there is she used DSConnect to help recruit for her study, and her recruitment was completed in 2 weeks. It was fantastic. So it was one of those things, a lot of families really jumped in and said, oh yes, we really want to participate in that one. I mentioned we do work with national organizations. So right here is the long list of all the different institutes at NIH who are involved in our consortium. We established a national consortium with all of these groups. And many of them should sound or look very familiar. There's NDSS. And we do have 2 self-advocates on the consortium as well. So we and parents. Some of these folks are kind of 2 and 3-fers. We really try to listen to the community and to work with the community. Part of it, honestly, is we don't want to duplicate efforts. You know, there's more than enough need to go around, so we want to make sure we're being as efficient as possible. Here's the homepage for DSConnect, the famous David Egan. He is fantastic, if anyone's ever worked with him. Security. So this is a huge concern of families, and I totally get that. Now, I will, as I was kind of joking earlier, you know, any of us who use Google, everyone probably knows where you are anyway. But we did go, and this was one of the reasons, frankly, it was expensive to set up this registry, because we kind of went the extra mile and paid, I can't tell you how many thousands of dollars to have it be FISMA compliant, that's the Federal Information Security Management Act. And so 250 security controls, encrypted information. We ask you to change your password every 10 months, which is a total pain, but it helps protect you. And if you ever get, you know, one of those spammy things saying, you know, give me your bank account information, that's not from us. So just wanted to mention that. Here's the, if you decide you are interested in registering, this is kind of the first page you will see. It's really not very complicated. You create your account by, you know, setting up a username and password. Review the online consent form, and I can talk more later if you'd like about that. It's consent, assent, and permission. Once you've done that and you click register, then you start out with a very basic, what we call the initial health questionnaire. Then you have the option of taking any or none of the other health questionnaires. So if your child doesn't have a congenital heart issue, don't fill out the congenital heart survey. In other words, and you can do it later too. So in other words, once you've done that initial health questionnaire, which doesn't take all that long, then you can do the rest of them at your leisure. And it, you know, it only helps. Here's I only provided the consent, but it's a very easy consent form. You do read something first, and then you decide whether you want to give consent or not. I mentioned earlier about choosing whether or not to participate in clinical trials. And you can change your contact and sharing preferences anytime. It's very easy. I mean, clearly we want to have your information in the registry, but once you've done that, if you don't want to be you decide, you know what, my family's going through a kind of a busy time. I really don't want to get these extra emails. So for 6 months, you can take yourself off of the clinical trial list and then go back on later. So it does allow a lot of flexibility. These are some of the different questionnaires. As I mentioned, the initial health questionnaire, and here are the other ones that are online right now. I called out the 3 that were most recently launched. Again, that came directly from the families. Leukemia we got up first. We probably should have had that up when we initially launched, but that we heard about that immediately. These 2 are very interesting. Again, it's as our children are getting older with, you know, children with Down syndrome are getting older, they have a lot of the same kind of reproductive health issues, other issues that everyone has. And so we kind of honed in on those in those 2 questionnaires. This just gives you, as of February 17th, kind of a sense of the makeup of this. We can drill down, but again, you can't. There's probably enough people in North Carolina where you could drill down, see how many people are in North Carolina. You would have access to this, so you can see. What you would not be able to drill down to is like a street, you know, because we wouldn't want to expose someone's personal information. But this just gives you a sense. We've got about a little more than, well, I'd say 400 or 500 international participants too. These are some of the other things that you are able to see. How much? 3. Demographics, this just gives you a sense of who's participating right now. Let me make it clear, this is not a representative sample across the US, but this is everyone who's participating. We would love to have more people who are older. This gives you a sense of the de-identified data and what specific sleep issues families are having. Here is, right here is where healthcare provider, and more particularly a researcher, would set up their own professional account so we know who they are. We do, let me see. Yeah, here's some of the examples of the types of research requests. The first one, of course, being Dr. Edgens. These are some of the ones we've gotten most recently. Let me say that we have a separate, Stephanie's very involved, a research review committee. So researchers come to us and essentially apply to have us help them with recruitment. And so these are some of the successful applicants, and it's really been very gratifying by how quickly most of them have been able to recruit new participants. And this is the last slide. I want to give a huge call out to my colleagues. I'm part of pretty much of a 3-person team at NICHD. Dr. Melissa Parisi, who's the chief of our Intellectual and Developmental Disabilities branch, and Dr. Sujata Barden, who's essentially the registry coordinator. And we work together very, very closely on this. I have flyers and take-home cards in the room in back, and I will be happy to answer any questions. Thank you.